Let's take you now to the United States, where the official unemployment rate rose for the first time in more than 9 years. When the Labor Department released its monthly job numbers today, the economy shed 701,000 jobs in March due to the impact of the coronavirus, bringing the official rate to 4.4%, a huge contraction from February when 270,000 jobs were added. The report is not reflective of the almost 10 million jobless claims that were filed in the last 2 weeks, meaning the unemployment rate is now actually far higher. SABC News correspondent Sherwin Bryce-Pease reports on this and other developments related to the COVID-19 outbreak in the United States.
With most businesses shuttered and large swaths of the country under some form of lockdown, the numbers were not totally unexpected, but still managed to deliver a gut punch.
Well, we're clearly living in something the likes of which we've never experienced in our lifetimes, and in some ways never in our history, because what's quite unique, and we're all living it every day, is that aspects of the economy have been brought to a stop. This is different from the financial crisis and recession, where we're talking about diminished economic activity. Back then, you could at least go out and buy a car if you wanted.
The US has seen 113 months of consecutive job growth before the pandemic gutted what was largely a booming national economy.
It is important for us to recognize that the surge in unemployment claims is an intentional policy response to the public health crisis. But the question is really, when will unemployment claims start to moderate, and to what level will they slow down to? Because that will signal whether these are just temporary layoffs or whether businesses are actually going out of business and actually permanently laying off workers. That's the concern for the long term. Are these layoffs just temporary, or when this crisis is over, will people be able to get back to work pretty quickly?
As arresting, the public health emergency becomes more critical by the day, not merely due to the economic impact, but the escalating COVID-19 caseload at close to 250,000 confirmed and more than 6,000 deaths and rising, with a new advisory issued for the country's epicenter.
We're advising New Yorkers to wear a face covering when you go outside and will be near other people. So let's be clear. This is a face covering. Again, we'll talk about the details in a moment, but it could be a scarf. It could be something you create yourself at home. It could be a bandana. It does not need to be a professional surgical mask. In fact, we don't want you to use the kinds of masks that our first responders need, that our healthcare workers need. Don't use those. I can't be clearer. Leave those alone. Leave those to the people who need them the most, who are saving lives. But you can create a face covering with anything you have at home right now, any piece of cloth.
With the US facing a dire shortage of protective gear, officials have advised healthcare workers to reuse and clean their disposable masks and gloves, rather than throw them away after each patient.
There won't be anyone left to take care of the public.
Nurses taking to the streets in protest outside this New York hospital.
This is outrageous that we have people coming and sewing things for us, sewing masks, sewing shields, making things out of plastics. This is what we're doing now? How? I mean, that would be like a soldier going to war and making a plastic gun to bring with him. This is what's happening. This is what we're doing. This is the situation, and the public needs to know, because they have to demand that we get the things that we need so that we can take care of people.
With numbers expected to surge in the coming days, the shortage of equipment, including ventilators, could further complicate efforts to save lives. The federal government announcing Thursday that it was invoking the Defense Production Act, an emergency statute that allows the government essentially to mandate that domestic private manufacturers produce materials and equipment that are in short supply, bowing to pressure from governors, mayors and health practitioners around the country who've been calling for this for weeks. Sherwin Bryce-Pease, SABC News, New York.
Well, we go live to Sherwin now for an update on a coronavirus vaccine clinical trials in the United States. Those are happening as well. Sherwin, thank you for being with us. So there's a big scramble, a lot of work being done, not only in the United States, but all around the world. So just tell us about the breadth of the effort that is underway to find a vaccine.
Yeah, this is certainly a collective effort, Francis, not only in the United States, as you correctly point out. China is developing something, Japan is working on something, various European countries, including the French and the Germans. We understand that there's a trial also ongoing in Canada. So this is a group effort on multiple fronts, given just the devastation we are seeing from this outbreak around the world. In fact, there's an Australian research company, the Australian National Science Agency, on Thursday, Francis, announcing that it had begun a first stage of testing potential vaccines. The head of that agency, Rob Grenfell, had this to say.
We're still sticking to the optimistic 18 months for delivery of vaccine to the general consumers. Now, this, of course, may change. There's a lot of technical challenges that we're having to go through. But what's remarkable is the speed that we're actually progressing with so many of the steps. Generally, the sort of phase that we're at would usually take 1 to 2 years to get to, and we've done this in around about 8 weeks. So this is the speed that's going on at the moment. Human trials will depend on the type of the vaccine. So the two candidates that we're trialling, one of them, we understand that they're planning human trials for either late April or early May. Now, that's dependent on the results of the studies that we're doing, and another laboratory in another country are actually doing on the safety and the efficacy, that is how the vaccine works. So they may well start sooner than we think. And now this, again, is enormous speed in getting vaccines out.
Francis, I can also tell you that there are two main sources of funding for some of these vaccines. One from the Biomedical Advanced Research and Development Department, which is attached to the Human Health and Human Services Division of the United States federal government, and then the National Institutes of Allergy and Infectious Diseases, of course, run by a name you will be familiar with, Dr. Anthony Fauci. But also people might be wondering why this is going to take so long. Vaccines go through rigorous processes, various phases to check for efficacy and safety. And then, of course, the very last phase will be the licensing of an approved vaccine. The Food and Drug Administration of the United States would get involved. And then the final step would be mass production and distribution around the world. So you can understand why this is such a laborious process to get to something that is safe, effective, and can be widely distributed.
It's huge. So in the absence of a vaccine, the focus remains on those social distancing guidelines. And you hinted there at the shift from the Centers for Disease Control in terms of wearing masks. What are authorities saying right now?
Yeah, well, you saw the New York Mayor, Bill de Blasio, announce that yesterday in terms of encouraging a new advisory for New York City in terms of people covering their faces. This was predicated on the fact that new research and new data was showing that a lot of people, some 25% of COVID-19 infected persons, were asymptomatic, Francis, essentially not showing symptoms, no fever, no cough, no chills. But yet had the ability, despite feeling okay, to infect others who may then become sick and have to end up in an emergency room. So this is an extra step, in addition to the 6 feet, the 2 meter distancing, the social distancing, the self-quarantining. If you happen to go out into a store, an elevator, a pharmacy, for those essential requirements that some people have, wear a mask as an additional layer of precaution. Of course, this was announced yesterday in his daily briefing by President Donald Trump in the press briefing room at the White House, and the president saying this is an advisory, it's a recommendation, but he would not be following it. So perhaps don't follow the president's advice, but maybe the CDC's, Francis.
Well, looking at the numbers, they are startling. Over 32,000 new cases in just a day. Friday brought the highest daily death toll of over 1,300 in the U.S. Officials saying the apex is coming in the next few days to weeks. We saw those nurses very concerned. What can you tell us about preparedness for what is coming, Sherwin?
Yeah, it's just staggering, some of these figures. 1,300 families lost a loved one just yesterday, and that's on top of the other 7,000 people that have died in the United States. We're at around 280,000, almost at, give it another day, almost 300,000 cases in the United States. We heard from New York State Governor Andrew Cuomo. They're still short of ventilators. Of course, ventilators essentially equipment that can determine the difference between life and death. He has signed an executive order to move ventilators from private companies and from hospital facilities in parts of the state that do not need them right now. Of course, ground zero of this epidemic this pandemic in the United States is New York City. So they're trying to build up capacity. The New York Mayor, Bill de Blasio, has asked for a national enlistment from the federal government to send healthcare workers and first responders to New York City because they are expected to reach this apex, what the governor calls the mountaintop, within the next week, Francis. So we haven't seen the apex of caseloads, of the number of deaths. That's still coming. So increasing ventilator capacity, getting boots on the ground. You know, there's a convention center in New York called the Jacob Javits Center, which has been retrofitted to be a COVID-19 hospital with 2,500 beds. Initially, this was going to be a hospital that would only receive non-coronavirus patients to relieve the volumes we were seeing on the current healthcare system. The federal government now deciding that this will be a COVID-19 hospital. So that is going to bring some relief. Whether there will be enough capacity will depend on the numbers we will see in the weeks ahead.
Sure, a very worrying situation in the United States. Thank you to our U.S. correspondent, Sherwin Bryce-Pease.